Hello, everyone, and welcome to the Biophotonics Discovery Podcast. Whether you're a seasoned researcher, a student just starting out, or you just love a good story about how light is used to solve big problems, this podcast is for you. We're making the discoveries in biophotonics accessible one episode at a time.
What Polarized Light Can Reveal About Ehlers-Danlos Syndrome by Kseniia Tumanova Alex Vitkin and colleagues in Toronto. Recent advances in biomedical optics have introduced new approaches for examining tissue microstructure in connective tissue disorders such as Ehlers-Danlos syndromes, EDS, a group of inherited disorders that affect the body's connective tissues, particularly collagen, and can lead to joint hypermobility, fragile skin, and other systemic complications. In this work, Kseniia Tumanova Alex Vitkin and colleagues explored the use of Mueller matrix polarimetry, a label-free imaging technique that measures how polarized light interacts with biological tissue. By applying this method to skin biopsies from individuals with classical EDS, hypermobile EDS, and healthy controls, the study examined whether quantitative polarimetric features could reveal differences in collagen organization between these groups. Diagnosing classical and hypermobile EDS can be challenging because the two conditions often have overlapping symptoms. In addition, hypermobile EDS currently does not have a confirmed genetic marker and is diagnosed mainly through clinical evaluation. As a result, it can take years for some patients to receive a diagnosis. The authors therefore explored whether polarization-based imaging could provide objective measurements of collagen structure in the skin that may help support clinical assessment. To investigate this, the researchers analyzed unstained skin biopsy sections from 19 participants, including 3 healthy controls, 5 individuals with classical EDS, and 11 with hypermobile EDS. Using a custom Mueller matrix microscopy system, they collected polarization-resolved images and calculated a set of quantitative polarimetric parameters. These parameters describe how tissue changes the polarization state of light and can reflect aspects of tissue microstructure, particularly the organization and anisotropy of collagen fibers. Among the parameters examined, 3 showed statistically significant differences between healthy skin and EDS-affected tissue. In general, healthy samples showed higher values for certain parameters associated with more uniformly aligned collagen, while EDS samples showed patterns consistent with greater structural variability. In addition, several parameters showed statistically significant differences between classical and hypermobile EDS. Notably, the linear polarization parameter was significant in both comparisons, suggesting that features related to linear polarization behavior may provide useful contrast between these tissue groups. Although these results are preliminary, they show that Mueller matrix polarimetry can provide quantitative information about dermal collagen organization without the need for staining or complex preparation. If confirmed in larger studies, this approach may offer additional information that could complement current clinical evaluation of Ehlers-Danlos syndromes. The technique also provides a relatively simple optical method for examining tissue structure over large areas of a biopsy sample. Importantly, while this proof-of-concept study was performed on biopsy sections, Mueller matrix polarimetry is fundamentally an optical technique and could potentially be adapted for direct, in vivo assessment of skin, which may allow collagen structure to be evaluated non-invasively in future clinical applications. Tumanova and colleagues emphasize that this study represents an early step in exploring polarimetric signatures associated with EDS. Larger and more balanced cohorts will be needed to confirm these observations and better understand their potential diagnostic value. Nonetheless, the findings suggest that polarization-based imaging may provide new insight into connective tissue structure and help guide future research aimed at improving the evaluation of Ehlers-Danlos syndromes.
If you enjoyed this episode, please subscribe, leave us a review, and share it with your colleagues. Your support helps us shine a light on the latest in biophotonics research. Stay curious, and we'll see you next time.